Here at CBS News, we are committed, we've talked about this several times, to stopping the stigma surrounding mental health. So we would like to take the shame and the blame out of discussing mental illnesses. Kim Kardashian West is pretty much asking for the same thing. She's asking for compassion and empathy after unusual comments made by her husband Kanye West on Twitter at a recent event. In a statement posted on Instagram yesterday, Kim Kardashian West talked about how her husband lives with bipolar disorder. She wrote in part, quote, "Anyone who has this or has a loved one in their life who does knows how incredibly complicated and painful it is to understand." Psychiatrist Dr. Sue Varma joins us now. We should note that Dr. Sue Varma does not treat Kanye West and has not spoken to the family, so she cannot speak directly about his condition. And actually, Sue, that's not what this conversation is about. It really is about bringing attention to this, because I thought what Kim did was very brave, and I think that it will be very helpful to others that she was so candid about what her family's going through.
Absolutely. And, you know, we have talked about on this show the idea of celebrities coming forward, and what it does is mainstream and normalize the conversation. And I want to say that it doesn't matter what kind of resources you have, struggle is still struggle, and the family members still feel helpless. And one of the hardest things about bipolar disorder, which is fairly common, it's about 1% of the population, but Gayle, I really think that it goes underdiagnosed for a lot of reasons. And because some of these symptoms, when a person presents, they might only present with one aspect of it. In bipolar disorder, we see a gamut of symptoms ranging from irritability, low mood, guilt, feelings of worthlessness, to high moods, to where a person might be extremely high functioning and creative, to symptoms of paranoia and disorganized thinking. So depending on when you come in, you may miss some of these other symptoms and not get diagnosed.
So, Sue, what is it exactly, and what is it that you think we most don't understand about it?
I think it's the unpredictability. It's hard for doctors to recognize, because when you go into a primary care visit or even a trained mental health professional, they're seeing you at one snapshot in time. And what they really need to do is take a longitudinal history and ask family members and ask them, does this person have difficulty falling asleep, or are they able to function on very little sleep? Do they make a lot of impulsive plans? Do they plan to, like, go from one city to another? Are they going to Vegas when, we had that freedom? Are they buying shirts in 5 different colors? Again, these are very stereotypical things, but are important to ask because they often get missed. The impairment in functioning is very severe. People don't realize that bipolar disorder often, and a lot of mental health conditions, when they're not treated, become chronic. And even though I'm very much of the belief of holistic lifestyle interventions such as talk therapy, exercise, and nutrition, there really is a role of medication in this, and a person may need to be on it for an extended period of time. And that can be hard for a person to swallow, especially when they're in the midst of a manic episode or a depression. They might be feeling paranoid, and they think that maybe someone's poisoned them. Maybe someone is out to get them. So the hardest thing about this is that a patient's own insight and awareness and judgment are affected by the illness.
A lot of the chatter around it was, why don't people get help? Why don't family members get help? Why don't people intervene? And in her letter, Kim pointed out, that's very difficult unless the individuals themselves want to engage in the process of getting help. So what can family members do? What can loved ones do in situations like these?
Be very involved in the person's life, be vigilant, get educated about it if and when they're willing, because there might be narrow windows of opportunity where somebody may say, I don't feel well, can you help me? They may not even ask for your help, but they might just appreciate your support. So I'm a big believer in family therapy. It's something I do in my practice. And even if I'm just treating the individual, I will try to engage the family time to time. The family members must be involved. Look, it takes a village to raise any person, a healthy person, but especially someone who's dealing with a condition or a disorder. We really need to rally against the person. What makes it hard is because often some of these behaviors, because they're erratic, Family members might feel alienated. They might feel pushed away. They might feel scared by the behavior. It's unpredictable. They don't know what to expect. A person might lash out and be angry at them. So I would say if you can understand this as a brain illness, not take it personally, and say, listen, in what capacity can I be helpful? Do you want me to drive you to your doctor's appointment? Do you want me to find you a doctor? I'll wait in the parking lot. I don't need to be a part of it. But if they're open to, and if they give you permission, try to have a conversation if you're a close family member to say, let me understand what are the symptoms and how can I help them? What are the medication? What are the side effects? Side effects of medication are a big reason why people get off of them and then relapse.
Yeah, I think what you said, Sue, was very important. Think of this as a brain illness. I mean, in our ongoing effort to reduce the stigma and the shame, what's the best thing you can say about that part of this conversation?
This needs to be taken very seriously. In the pandemic, all of us are experiencing heightened stress. You are not alone. Please don't feel isolated. There is absolutely no shame, no stigma. You're not less of a person. You didn't cause this to yourself. Please get help. Help is available. Take your time, do your due diligence, find a trusted person, and give the treatment some time. It always takes time to work.
All right, Dr. Sue Varma, always good to see you. Thank you very much. If you or someone you know is seeking mental health resources, you can call the National Alliance on Mental Illness helpline. That number is 1-800-950-6264. I know it's hard to write it down quickly, so we'll have it on our website. Or in a crisis, you can text NAMI to 741-741.